Home health nurses are registered nurses who give specialized care to a patient in the patient's home, unlike most nurses who perform care in hospitals. The history behind this profession started in England in the 1880s, where a man named William Rathbone and Florence Nightingale formalized this type of care. It started when they noticed that some sick and poor couldn't come to the hospitals, so they decided to bring the hospitals to them by taking care of them in their very own home. Also, in the 1800s, the American nurses heard what Nightingale was doing overseas and decided to do the same thing. There are about 1.4 million home health nurses in the United States. Out of the 1.4 million, 99.7% of them are RNs, and 87% of them are women. There are about 4.5 million patients nationwide that require the assistance of a home health nurse. The salary of a home health nurse in California is $86,427 as of October 2020, but the price can range between $77,881 and $98,811. It really depends on the city where the nurse works, their education, and the number of years the nurse spent in that profession to really determine how much they make.
So what's the process like to become a home health nurse? First, you would have to get educated and get that degree or certification. You can get either an LPN, an associate's degree in nursing, or a bachelor's degree in nursing. Next, you would have to study and pass the NCLEX. If you pass this, you'll get your nursing license and become a registered nurse. Once you have your degree and become a registered nurse, now you're ready to apply for the job. It's preferred to have some experience in any kind of nursing setting, but you'll still have a chance without experience.
Home health nurses preferably work in the homes of their patients, but they are put in these homes because of their home health agency. There are about 12,000 agencies in America, and these agencies will basically analyze the patient's needs and send a nurse who can provide the best care at the situation at hand. The agency will basically choose and match a nurse and the patient together after doing thorough research. A home health nurse can have multiple patients at a time, meaning they can visit multiple patients' homes a day. If needed and agreed upon, the nurse can spend the night at the patient's home. Not only can they work in homes, but they can also have temporary jobs in hospitals and other medical facilities. Although it is rare, home health nurses can also travel internationally to conduct work. Out of the 4.5 million patients, home health nurses care for the elderly, and out of the elderly population, 81.9% are over the age of 65. 60.9% are women, while the remaining 39% are men. Out of the elderly population, 3.7% are Asian, 7.4% are Hispanic, 12.9% are Black, and the remaining 76.1% are white. Not only do they care for the elderly population, but they also care for the terminally ill, disabled, patients who are recovering from an injury or accident, people with chronic disease, post-surgery, and veterans. They also work with pregnant women and help new mothers by supporting them and teaching them how to nurse their child.
There are some pros and cons when it comes to working as a home health nurse. An advantage of working as a home health nurse is being able to visit one patient at a time. It helps with building a better and more personal connection with the patient and their family. Another benefit of being a home health nurse is having more flexibility with scheduling and finding out what's best for your patient and yourself. Other advantages are working independently to build onto existing skills and having the patient be more comfortable in their own home than in a busy hospital. Some disadvantages of being a home health nurse include working in an unfamiliar and unpredictable work setting compared to working in a hospital, and using a personal vehicle to transport oneself from patient to patient. Another disadvantage is that some patients or their families may not want a nurse to be in their homes, possibly due to them wanting privacy, or sometimes homes may pose a potential risk to the nurses depending on the state of the house, or if there are things that may cause an allergic reaction.
Home health nurses. These are skilled medical professionals who provide home health care at its most basic level. Many patients require assistance and care provided within the home, and this is usually less expensive, more convenient, and just as effective as care given in a hospital or nursing facility. Servicing for daily needs and personal care. The movement of patients across care settings is referred to as care transitions. In order to maintain and promote wellness, long-term care from highly skilled, knowledgeable professionals will be required. Services available to home health care patients include Medicare Home Health Benefit, Medicaid Home Health Benefit, Veterans Administration Home Health Care, and home care, long-term care provided at home. Medicare Home Health Benefit. This benefit covers skilled nursing care and therapy services provided within the patient's own residence. Requirements are the patient must be under the care of a physician and meet the definition of homebound. Services include speech-language pathology, physical therapy, occupational therapy, and a medical social worker. Medicaid Home Health Benefit. This benefit will vary by state and will generally cover more than the previous mentioned Medicare benefit. It's a combination of highly skilled medical care and personal care services. This also will provide transportation to care along with home health services, which will include occupational and speech therapy, pediatric care, physical therapy, private duty nursing services, personal care, and case management. Veterans Administration Home Health Care. Veterans have several choices when it comes to home health services, depending on what level of care is needed. Skilled Home Health Care Services, or SHHC, are for short-term needs and include therapy, nursing care, and social work support. Home-based primary care is set up for veterans with moderate to complex health needs. Primary care visits are conducted in-home along with mental health and case management services. Homemaker and home health aid care assist veterans with all daily living needs. One way to improve America's healthcare delivery system is by ensuring better care transitioning from hospital settings to residents. Home healthcare nurses are innovative solutions for patients and their families. Nurses help to coordinate across care settings to assist patients with efficient care in the comfort of their own homes to improve recovery and quality of life.